Metabolic syndrome is a common problem today.
代謝症候群喺今日嚟講係一個普遍嘅問題。
It is not a disease, but a combination of diseases.
佢唔係一個症狀喎，乃係一群嘅症狀。
So during this presentation, we are going to talk about the definition of this disease.
我哋咧會同大家探討一下代謝症候群嘅定義。
And mostly, what are the factors that we can do to prevent metabolic syndrome?
繼而我哋同大家探討一下我哋點樣去預防呢個症狀。
So if you see in this slide, the metabolic syndrome is related to 4 basic problems.
大家可以睇翻呢個圖片，原來代謝症候群係同4個問題有關。
Like diabetes, cholesterol, hypertension, and overweight.
係指糖尿病啦、膽固醇高、高血壓同埋體重超重。
So if a person has a tendency to those problems or have some of those problems, we consider that a person has metabolic syndrome.
所以如果你有個趨勢係患上呢啲疾病，或者已經患上以下嘅疾病嘅話咧，其實你就已經係患上咗代謝症候群啦。
The doctors, however, they have another more complicated definition.
而醫生咧亦都會有另一個嘅定義嘅方法嘅噃。
So clinically, metabolic syndrome is defined as a person who has 3 or more of these 5 factors.
而喺臨床嘅定義咧就係話，如果以下嘅5項裏邊你有3項嘅話咧，你就已經患上咗代謝症候群啦。
The first is related to obesity, the waist circumference.
第一個咧就係同肥胖有關嘅，係關於腰圍。
One point for metabolic syndrome would be for men if he has more than 90 centimeters, and for female if she has more than 80 centimeters.
如果一個男士佢嘅腰圍係超過90個厘米，而女士超過80厘米嘅話咧，佢咧就係中央肥胖啦。
Another point would be a blood pressure over 120 and 80.
另一個就係如果佢嘅血壓係高過120/80嘅話，佢就得到另外1分。
For blood glucose, the value should be over 5.5 millimoles per liter.
而喺呢個血糖方面，佢超過5.5嘅國際單位嘅話咧，佢又得到另外1分。
Another point should be triglycerides higher than 1.7 millimoles per liter.
而喺三酸甘油脂方面，佢超過1.7嘅話咧，佢又得到另外1分啦。
And lastly, HDL cholesterol.
最後咧就係高密度脂蛋白。
HDL cholesterol is the good cholesterol, so you should have higher levels. So if you have lower levels, you have points for the metabolic syndrome.
所以當呢個好嘅膽固醇越多嘅時候咧，我哋咧就會係能夠預防到。但係咧，如果佢係少嘅話咧，我哋就會得分啦。
So one more point for metabolic syndrome would be a level of HDL lower than 1 for men and lower than 1.3 for female.
所以如果你嘅三酸甘油脂嘅數值，男士如果係低過1，女士低過1.3，你就會得到另外1分啦。
Metabolic syndrome, as you see, is a disease related to our lifestyle.
代謝症候群其實同我哋嘅生活模式好有關係。
What we drink, what we eat, and what we do is the cause of this terrible disease.
我哋食嘅嘢，我哋飲嘅嘢，甚至係我哋做嘅嘢，都會影響到我哋會唔會患上呢個疾病。
We are happy with this lifestyle and we feel very relaxed.
有時我哋中意做乜就做乜，我哋覺得好輕鬆同埋好開心。
But those activities are killing us.
但係呢一種咁嘅生活模式，其實喺度殺害緊我哋。
So the only way for us to prevent, to treat this terrible disease is to change our lifestyle.
所以如果我哋想預防或者係治療呢個疾病咧，我哋就要改變我哋嘅生活模式。
So let's take a look at metabolic syndrome in the world.
我哋去睇下全球性又點樣啊？
Statistics say that 40% of people between 60 and 70 years old have metabolic syndrome.
研究顯示 喺60至70歲嘅人群當中，大概有40%嘅人係患上呢個症狀。
In Hong Kong, the statistics are not that different.
而喺香港咧，似乎咧都好相若喎。
17 to 21% of the normal population,
大概係有17至21%嘅人係患上代謝症候群。
however, in women over 60 is almost more than 50%.
如果一位女士佢係超過65歲嘅話咧，佢哋患上代謝症候群，大概咧就超過一半嘅人。
Metabolic syndrome is a complicated disease,
代謝症候群係一個比較複雜嘅問題，
or a complicated name.
個名亦都複雜。
Then I decide to describe the disease in simple terms.
所以咧，我想用一啲簡單嘅方法去定義。
So a person that does not exercise, is overweight and eat too much fat and sugar,
我嘅定義係，當一個人係冇運動啦、超重啦、食好多脂肪，同埋咧係食得糖分過多，
or eat too little fiber and fruits and vegetables,
食嘅纖維質唔足夠啦，唔多嘅水果同埋蔬菜，
or just eating too much and watching too much TV.
或者食嘅份量太多，用太多嘅時間坐喺度睇電視。
So if you have one of these problems, you are on the way of metabolic syndrome.
嗱，所以以下嘅問題，如果你全部都有嘅話咧，可能你已經係朝向呢個代謝症候群啦。
So as you see, metabolic syndrome is a complicated name with a simple cause.
雖然聽落去代謝症候群好似好複雜嘅名，但係佢嘅成因卻係非常簡單。
It is a disease related to our lifestyle.
呢個病係同我哋嘅生活模式有關係。
So now let's take a look on some individual components of metabolic syndrome.
不如我哋逐個嚟睇下。
The first one is diabetes.
首先我哋睇下糖尿病，
How frequent diabetes is in the world?
究竟喺全世界嚟講，有幾多人患上糖尿病呢？
The estimate by 2025 is that we will have 300 million cases of diabetics in the world.
據估計，去到2025年嘅時候，將會有差唔多3億嘅人口患上糖尿病。
For sure, this is going to be worse than AIDS, SARS, or bird flu.
比起愛滋病、沙士或者係禽流感更加嚴重。
The problem is that most of these cases are going to come from China.
但係最令我哋關注嘅咧，就係原來大部分嘅咧都喺中國發生喎。
At least 37 million people in China will have diabetes.
我哋估計去到2025年，會有3700萬嘅人口患上糖尿病，
And worse, 57 million in India.
而喺印度就更糟糕啦，會有超過5700萬嘅人係患上糖尿病。
The incidence in Hong Kong is about 10% or 600,000 diabetics.
至於喺香港方面呢，就大概有1成嘅人係患上糖尿病，
And 29% of women over 65 years old have diabetes.
而超過65歲嘅女士，佢哋大概有3成嘅人係患上糖尿病。
So what's the problem with diabetes?
咁糖尿病會有咩問題出現呢？
So the main complications of the disease is coronary heart disease, stroke, and kidney failure.
而佢主要嘅併發症係有心臟病、中風同埋腎衰竭。
And then cancer, amputations, and blindness.
癌症啦、截肢啦同埋眼盲。
I am not that concerned about the terrible disease that are complications of diabetes.
嗱，其實咧，我講到糖尿病嘅併發症咧，其實我唔係好擔心。
Like heart disease, stroke, kidney failure, and cancer.
特別咧係講到心臟病啦、中風啦，或者係腎衰竭。
I'm more concerned about the risk of being blind and lose your vision.
我咧最關注嘅咧就係，如果我失明，我睇唔到嘢。
I'm wearing those things just to show you that being blind and losing one leg is a terrible consequence of diabetes.
如果盲咗或者失去咗個腳，呢一個咧就係一個最悲慘嘅後果。
I will never forget that because my father lost his eyesight and lost his leg because of diabetes.
我永遠都唔會忘記，因為我爸爸咧就係因為糖尿病就睇唔到嘢，同埋咧係失去咗隻腳。
The new complication here is cancer.
嗱，呢一個比較新嘅併發症咧就係癌症。
Current research has mentioned or has found that cancer is related to high levels of insulin.
最新嘅研究顯示，癌症同呢個高水平嘅胰島素係有關係。
Insulin is a hormone that is high in diabetics, and this hormone increases the development of cancer cells.
而糖尿病人佢哋身體裏面嘅胰島素水平較高，而胰島素咧相信就係有助癌細胞嘅生長。
As we mentioned in the beginning, there are new values for blood glucose.
一開始嘅時候，我哋就有講到啦，血糖嘅正常值有新嘅發展。
In the past, we consider a person with diabetes when they have a blood glucose level over 7.
以前咧，我哋就話，如果一個人嘅空腹血糖超過7，佢就係患上糖尿病。
But a few years ago, they changed the definition, and now a person that has 5.5 millimoles per liter already have what we call pre-diabetes.
而最新佢哋嘅定義就係話，如果一個人佢哋嘅空腹血糖係超過5.5嘅話咧，其實佢已經係有糖尿病嘅先兆啦。
Don't take me wrong. It doesn't mean that you have diabetes, but you have to do something because if you don't, you will have diabetes tomorrow.
嗱，我唔係話你超過5.5就已經患上糖尿病，嗱係話俾你聽，如果你已經超過5.5嘅時候，你就需要係做一啲嘅嘢去預防糖尿病嘅出現。
So now let's talk about prevention. What is the best diet to prevent and treat diabetes?
我哋依家咧就講下預防方面，究竟有啲乜嘢嘅飲食習慣係有幫助去治療同埋預防糖尿病呢？
The main thing is related to fiber.
首先最重要咧就係要有足夠嘅纖維質。
So a person with diabetes should eat more vegetables and more fruits and more whole grains.
嗱，如果糖尿病嘅病人，佢哋需要咧係食多啲蔬菜類啦、全麥五穀類啦嘅食物。
And should eat a low-fat diet, mostly low animal fat.
要食低脂肪嘅食物，特別係低動物性嘅脂肪。
The other very important point is to eat more beans like soybeans, black beans, chickpeas, kidney beans, etc.
其次就係要多食豆類，例如黃豆、黑豆、雞心豆、腰豆等等。
And then, of course, to avoid sugar, sweets, and refined foods like white rice and white bread.
當然唔可以食糖啦，或者係一啲糖果啦，甚至咧係一啲精製嘅食物，例如係白米飯同埋白麵包等等。
For the treatment and prevention of diabetes and metabolic syndrome, we have to choose the right type of foods.
去預防糖尿病或者代謝症候群，我哋一定要揀啱食物。
In my right side, we have the foods that diabetics should avoid.
而喺我右手邊嘅食物咧，呢啲係糖尿病患者應該盡量避免去食㗎，
Foods like potato chips
例如薯片啦、
and sodas
汽水啦、
and chocolate
朱古力、
and fat
脂肪，
and refined grains like white rice.
一啲咧經過打磨嘅一啲嘅白米飯。
I talk about white rice that is very common in Asia.
我想咧講少少關於白米飯，因為咧喺亞洲人咧係好中意食白米飯㗎。
I believe we have a lot of diabetes in these countries because they eat a lot of white rice.
嗱，可能我相信咧，其中點解咁多人患糖尿病咧，就係因為佢哋食得太多咧係提煉咗嘅白米飯。
So my advice is to avoid white rice and eat more red and brown rice.
咁我建議大家食少啲白米飯，食啲咧糙米、紅米。
So now let's take a look on the foods that are good to prevent and treat the diabetes.
嗱，我哋睇下咧有啲咩食物係能夠幫助預防同埋治療糖尿病呢？
The first category is the vegetables,
首先咧就係蔬菜，
like broccoli and asparagus and bok choy.
嗱當然呢度包括咧就係西蘭花啦、蘆筍啦同埋白菜啦。
Then the second one are the beans.
其次咧就係豆類啦。
So you see that for my patients, I always advise that they should eat at least 1 cup of beans per day.
我通常咧會建議我病人每日咧食一杯嘅豆。
So the next category is the grains or whole wheat bread and brown rice, as I mentioned before.
跟住咧就係咧全麥嘅麵包或者係咧糙米同米飯。
The reason that these foods are good is because they are rich in fibers.
嗱，點解我會講呢啲食物係好嘅咧？因為佢係好豐富嘅纖維質。
And most of these fibers decrease the absorption of sugar in the intestines.
咁而纖維質咧就係有助咧好有效咁樣控制咧呢個血糖喺小腸度吸收嘅。
Then for those that have diabetes, it's good to choose fruits that are low in sugar,
至於選擇水果方面咧，我哋就要揀一啲低糖分嘅水果啦。
like orange and avocado.
呢度咧就有橙啦，或者係牛油果。
And specifically, avocado also has good properties because decrease cholesterol.
嗱，牛油果咧，佢有佢一個好特別嘅性質喎，因為咧佢可以降埋膽固醇添。
So now you have a good picture of what is good and what is bad for the treatment and prevention of diabetes.
嗱，所以大家可以睇到啦，喺預防或者係治療糖尿病方面咧，我哋見到邊一啲係好嘅食物，邊一啲係唔好嘅。
Now let's talk about good news for diabetes.
我哋講一講對糖尿病者嘅一啲佳音啊。
There are some herbs, there are some foods that are good to prevent and to treat the disease.
有一啲嘅食物，有啲嘅草本植物係對於預防糖尿病有幫助嘅。
And the first one is what we call bitter melon,
首先就係苦瓜啦，
or in scientific names, Momordica charantia.
或者佢有一個咧係更加科學化嘅名。
Bitter melon has a substance called polypeptide P.
喺苦瓜裏面，佢哋發現有一種嘅物質係叫 polypeptide P。
This polypeptide P is a substance that is very similar to insulin and then can help the people that have diabetes.
原來佢有呢一種嘅物質，佢個樣咧係好似胰島素嘅喎，所以咧就有幫助糖尿病嘅控制啦。
And this is very important because people that eat bitter melon every day and have diabetes, they have to report their doctors that they are using this kind of food.
嗱，所以一個糖尿病患者，如果佢哋每日都有食苦瓜嘅習慣，可能佢要話俾佢嘅醫生聽，去留意一下呢個血糖嘅控制。
The dose can be like a cup of fresh juice of 150 ml per day.
而我哋建議每日咧係可以飲大概50至到150毫升嘅一啲新鮮榨嘅苦瓜汁。
Or if a person does not like the taste, he can use as a powder, like 3 to 15 grams of the powder or 300 to 600 milligrams of the extract.
如果佢唔中意嗰種苦味嘅話咧，佢可以試下用一啲粉末，大概咧3至到15克每日。咁而咧或者一啲精華抽出嚟嘅，大概係300至到600毫升每日嘅。
I brought a bitter melon with me
我帶咗一個苦瓜嚟，
just to show the exact size of a melon that we advise to eat every day for those that have diabetes.
呢個咧我哋就係建議糖尿病人咧每日食嘅份量啦。
So a person that has diabetes also have to inform the physician about that you are eating苦瓜 every day.
嗱，所以咧，如果你真係每日都食苦瓜嘅話咧，你就要話俾你嘅醫生聽喎。
because they have to adjust the medication.
有好可能咧，佢哋需要係調教你嗰啲藥份㗎。
You can eat it raw or cook it.
你可以生食，又可以煮熟食。
And some people also make a juice of it.
有啲人咧中意榨汁。
You just have to take out the seeds that are inside and eat just the skin and the pulp.
嗱，最主要咧，如果你真係要榨汁嘅話咧，你都將嗰啲核挖咗佢。
I hope you have fun with your fukwa.
希望你都享受呢一個苦瓜餐啦。
There are several other herbals good for diabetes.
仲有其他嘅草本植物對糖尿病都好嘅噃。
I'm going to mention now Gymnema sylvester, an herbal from India.
其中一種就係喺印度出產嘅。
Also, it has properties to enhance, to increase the insulin production.
而呢一種嘅草本植物係有幫助胰島素嘅生產。
And then we advise the dose as 400 milligrams of the extract per day.
而每日咧，我哋係攝取大概400毫克就足夠噶啦。
So apart from diet, we can do something in terms of exercise.
除咗飲食之外咧，我哋喺運動方面亦都要留意喎。
In the graphic that you see here, you have a study done with volunteers for 1 year.
嗱，呢一幅嘅圖片咧就顯示咧有一班嘅志願人士，佢哋用咗1年嘅時間去做運動。
Before and after the program, the participants were taking what we call the glucose tolerance curve.
喺運動前同埋運動後，佢哋都做一個內糖嘅測試。
The curve is measured that they give to the patient 50 grams of sugar and measure blood glucose every 30 minutes.
而嗰個內糖嘅測試就係話喺空肚嘅時候，佢俾佢有50克嘅葡萄糖去飲，然後咧每30分鐘去量度血糖一次。
So in this graphic, you see here the upper curve is before the test and means that all the participants have diabetes.
而喺上面呢一條線咧，就係表示呢一班人喺未開始運動訓練之前，佢哋內糖測試嘅結果。
So after 1 year, they did another curve, and this is the lower curve that we see in the graphic.
而下邊嗰條線就係經過1年嘅運動訓練之後，佢哋嗰個內糖測試嘅結果。
So after 1 year of exercise, everyday exercise, they got a normal curve.
嗱，所以經過1年嘅運動訓練之後咧，佢哋嘅血糖已經係正常返好多啦。
Based on this graphic and on this study, I conclude that the main thing for diabetes is exercise.
所以就從呢一個嘅研究裏面咧，我做一啲嘅結論，原來運動咧對於控制糖尿病係非常有效嘅。
So you see that this result was reached without food, without any diet, without any herbals, just doing exercise every day.
因為呢一班人嘅轉變並唔係飲食或者係其他，只係運動嘅轉變啫。
Good morning, Mr. Wong. I see here that you have been a patient of mine for 1 month already. How are you doing today?
黃生你好喎，我睇翻你嘅記錄咧，其實你已經上個月睇過我噶咯喎，依家見點啊？
Good morning, Dr. Santos. Yes, I have been with you for 1 month already.
山道醫生你好啊，係啊，我上個月嚟睇過你噶啦。
And I'm following your treatment all the time.
你叫我做啲咩咧，我都照做噶喎。
Not good news, Dr. Santos, not good news.
唔係好消息喎。
I have here a glucose meter and I have done that every day.
我咧帶埋個血糖機嚟，其實我每日都有篤手指㗎。
I did exercise every day for 2 weeks.
我咧對上嗰2個星期咧，每日都有做運動。
Not good, not good.
但係咧，完全咧啲血糖都唔好嘅。
It didn't drop, the blood glucose didn't drop 1 millimeter.
就算話咧，哇，一啲都冇降低到喎啲血糖。
So I stop exercising. It doesn't help me.
所以咧我停咗啦，因為都幫唔到我嘅。
Sorry, DrSanto, but I need something else.
唔好意思啊，你可唔可以介紹另外一啲嘢俾我啊？
Mr. Wong, remember I show you some statistics about diabetes.
黃生，你記唔記得上次我俾你睇呢一啲研究報告㗎？
I show you that in one study it took 1 whole year for the blood glucose to be normal.
其中一個研究咧就講到咧，你需要咧1年嘅時間咧，去將個血糖控制翻好喎。
So I really need you to exercise every day for a longer time.
所以我希望咧，你能夠繼續每日都做運動，繼續落去。
It is not a matter of 1 day, 1 week, or 2 weeks.
唔係一日、1個星期或者2個星期嘅事，
It's for 1 year or
係
longer.
一年或者更多嘅時間喎。
Maybe you need to do exercise for the rest of your life.
可能從今日開始，你每日都要做運動啦。
Other studies also show that exercise helps to prevent diabetes and metabolic syndrome.
其他嘅研究亦都顯示運動有幫助預防代謝症候群同埋預防糖尿病。
You see in this graphic the result of this study.
我哋可以睇到呢一幅圖片咧，就係個結果啦。
So people that exercise is represented in the yellow column.
黃色呢啲線咧，就係代表有運動嘅人。
So in the left side you see that they have 50% less metabolic syndrome.
咁你可以睇到佢哋咧患上呢一個代謝症候群咧，係可以降低50%。
So in the right 2 columns, the yellow column represent 60% less diabetes for those that exercise.
而嗰啲做運動嘅人咧，佢哋患上糖尿病嘅機會係降低60%添。
And what type of exercise is good?
究竟乜嘢嘅運動係好呢？
I would say any type.
其實每一種運動都好。
In this study done with women, they just asked the women to do some weight training.
有一個研究咧，就係叫一啲嘅女士咧係做一啲阻力嘅訓練。
And the researchers found that if a person train the muscles and do weight training, they improve the mechanism of insulin.
咁當呢一班嘅人佢哋係有做一啲阻力訓練嘅話咧，佢哋發覺佢哋控制糖尿病係好好多喎。
Now let's talk about cholesterol.
跟住落嚟就係講膽固醇啦。
As you saw, cholesterol is also one of the factors of metabolic syndrome.
嗱，我哋都知道啦，係咪？代謝症候群其中一個症狀咧就係高膽固醇。
And cholesterol is high risk for heart disease.
如果高膽固醇嘅話咧，患上心臟病嘅機會率亦都高啲。
What we advise for cholesterol is the use of vegetable fibers.
要好好咁控制呢一個膽固醇咧，就係要大量咁攝取呢個嘅纖維啦。
First, we advise the use of viscose fiber like oat, barley, psyllium, legumes, and eggplant.
嗱，首先我哋就係對於呢一種纖維啊，特別咧係一種有黏性嘅纖維咧，係最好多啲食取嘅，例如係一啲燕麥啦、大麥啦等等。
Then the second point is to use more vegetable proteins from beans.
另外就係多啲咧係食用植物性嘅蛋白質。
And then we advise to use the right types of fat.
然後咧，我哋需要食一啲好嘅脂肪。
Yes, fat helps to decrease cholesterol, even though you don't believe on that.
可能你唔會相信，原來脂肪都有幫助我哋降膽固醇。
Like the type of fat called plant sterols, it helps to decrease cholesterol, and it can be found in the market with the name Benecol.
而呢一種咧就係我哋所稱為嘅植物固醇啦。咁咧其實我哋喺超級市場都可以買到嘅喎，佢個名咧就叫 Benecol。
But it's not just this type of fat. Even avocado contains also plant sterols.
但我哋發現原來喺牛油果裏邊咧都含有呢個好豐富嘅植物固醇。
And another type of vegetable fats are nuts that are very good, in this case almonds, to drop blood cholesterol.
另外咧就係植物裡面嘅果仁，果仁裡面嘅油脂咧，例如好似杏仁咁樣啦，都有幫助咧係降膽固醇嘅。
In order to put in more practical terms Dr. Jenkins' diet,
講到專權醫生咧，佢嘅飲食療法咧，呢一度咧，我想同大家分享一啲實際啲嘅方法。
we decide to bring in practice here the four types of food in the 4 different groups.
呢度有4類唔同嘅食物。
So he advised 1 cup of oatmeal and 1 cup of beans.
佢建議我哋咧每日咧係食1杯嘅燕麥同埋1杯嘅豆。
Then have cup of almonds.
半杯咧係呢個杏仁。
And remember that he mentioned about a type of margarine called Benecol.
嗱，記唔記得咧？佢講到咧，其中有一種係植物固醇咧 ，Benecol 記唔記得啊？
Benecol has what we call plant sterols.
嗱喺個 Benecol 裏邊咧，其實佢係有植物固醇。
We know that avocado also has plant sterols.
咁而喺牛油果裏邊咧，亦都有好豐富嘅咧，就係呢個植物固醇。
And that's why we decide to exchange the Benecol for avocado.
所以咧，我哋就會用呢個牛油果去代替咗啦。
Also, we know some studies that show if a person eats 1 avocado per day, he also can decrease blood cholesterol.
咁咧喺研究裏面顯示咧，嗰啲人啊，如果每日係食1個牛油果嘅話咧，亦都有幫助去控制呢個膽固醇。
So, the Jenkins diet is very simple. It's just to add these foods in your normal diet and follow this for at least 4 months and you will have a very good effect on your cholesterol.
所以精勤醫生其實就建議我哋將呢一啲嘅食物咧加入去我哋日常嘅飲食裏面，4個月之後咧，你就會睇到個效果㗎啦。
Now let's talk about hypertension.
跟住我哋講下高血壓。
As you see, we have new values for blood pressure.
嗱，呢一度咧就係一啲血壓嘅最新指標。
In the past, as a doctor, I used to classify a person with hypertension when the values are over 140 and 90.
嗱，作為一個醫生咧，以往咧我就會係診斷啲病人，如果佢嘅血壓係高過140/90嘅話咧，佢就係患上高血壓。
But now we are talking about 120 over 80 and higher than that.
而依家我哋講緊就係話高過120/80或者更高。
But don't worry, if you have 120 over 80, it does not mean that you are in trouble or that you have hypertension.
嗱，你唔使擔心住，如果你嘅血壓係高過120/80嘅話咧，其實咧你唔係已經患上咁解。
So you don't need to take medication right now, but you have to change something in your lifestyle in order to prevent the chance to have hypertension tomorrow.
嗱，只不過係話，當你咧係發現你嘅血壓高過120/80咧，你就需要係改變一下生活模式，使至到咧唔會真係患上高血壓。
So the new advice for controlling of hypertension is what we call the DASH diet.
嗱，其中一種有幫助係控制血壓嘅飲食，就係叫做 DASH 嘅飲食習慣。
And DASH means dietary approaches to stop hypertension.
呢個咧就係話用一個飲食嘅模式去預防或者係停止再患上呢個高血壓。
One of the characteristics of this diet is to eat 8 to 10 servings of vegetables and fruits per day.
嗱，其中咧就係話佢建議我哋咧每日係攝取8至10份嘅蔬果。
And also they advise to eat whole beans and whole grains.
其次咧就係咧食呢個全麥類嘅五穀啦，同埋咧大量嘅豆類。
Of course, you know that sodium or salt is not good for hypertension.
當然太鹹或者含鈉質太高嘅食物對我哋嘅血壓唔好啦。
And exercise.
跟住就係運動。
So studies have shown that regular exercise, at least walking 30 minutes per day, is enough to drop blood pressure.
研究顯示每日只係步行30分鐘就已經有效咁降低血壓啦。
In order to eat 8 servings of fruits and vegetables to control hypertension,
嗱，如果我哋要食8份嘅蔬菜水果去控制，
we brought here 8 servings that you should eat during one day.
咁呢度咧就係8份蔬菜水果啦，就係我哋一日要食嘅份量。
One serving of vegetables, raw vegetables, is 1 cup of raw vegetables.
嗱，如果咧你係生嘅蔬菜咧，呢度講緊咧就係1杯。
So, or half cup of cooked vegetables.
嗱，如果煮熟咗嘅蔬菜咧，就係半杯嘅份量為之一個份量嘅。
Or 1 fruit at the size of a normal orange.
嗱，一個普通嘅 size 即係個普通 size 嘅橙咧，呢個為之係1份啦。
So, in order to control blood pressure, the best way is to eat more foods, but the right types of foods.
嗱，所以如果控制呢個嘅血壓咧，咁就係我哋要選擇合適嘅食物。
Do you believe that hypertension is related to your personality?
你相唔相信高血壓同你嘅個人嘅性格有關呢？
Is there any connection between emotions and hypertension?
而喺情緒同埋血壓方面又有冇咩關係呢？
Dr. Tibbets made an interesting study.
而Tibbets 醫生咧，佢做咗一個好有趣嘅研究。
He proved that a person with high levels of anger and hypertension could lower the blood pressure if they control the anger.
佢發現咧，原來憤怒同血壓有關係喎。當一個人能夠好好咁控制佢嘅憤怒嘅話咧，佢血壓都會降低。
If you see in the results of his study, you see the anger score in the second column that are very high.
你喺睇翻呢一個表格，你可以睇到咧，就係開始嘅時候佢嗰個嘅憤怒指數係好高㗎。
And if you take a look on the column of initial blood pressure, all of these guys have high blood pressure.
所以咧開始嘅時候佢哋嘅血壓咧全部都超標嘅。
And after 2 months of treatment or anger management courses, they normal the blood pressure.
所以經過2個月嘅時間咧，佢哋參加啲嘅憤怒治療小組，佢哋嘅血壓都降低咗。
So now let's talk about weight control.
跟住咧就講下體重控制啦。
In fact, everything that we mentioned for diabetes, for cholesterol, and for hypertension is applicable to weight control too.
嗱，之前我哋所講咧，對於控制糖尿病啦、高血壓啦同埋膽固醇嘅飲食方法咧，對於呢個咧同樣都有幫助。
Talking about the relationship between blood pressure and anger,
講緊呢個憤怒同埋血壓嘅關係，
I would say that the first thing is to control your anger.
嗱，第一樣首要嘅咧就係控制我哋嬲怒嘅情緒。
However, I would like to emphasize another point of this relationship.
嗱，而呢一個關係咧，我想咧強調另一個層面。
What I mean is that we should put more positive emotions in our life.
我希望咧大家能夠建立多一啲正面啲嘅思想同埋一啲嘅情緒。
And this means to have more laughter, to have more humor, to have more positive thoughts.
多啲歡笑啦，多啲幽默感啦，同埋咧有個正面嘅積極嘅思想。
A positive emotion will drop your blood pressure and also will affect your circulation and improve your immune system.
因為咧佢能夠咧係控制你嗰個情緒啦，使至到你嗰個血壓咧係降低，並且咧改善你嘅血液循環，使至到你咧係能夠達至到改善免疫系統嗰個嘅情況㗎。
So a diet low in fat, low in sugar, high in fiber, less meat, less refined foods.
呢度講緊就係低脂肪、低糖、高纖維、少肉類、少精製嘅食物。
And more exercise, of course.
當然係做多啲運動啦。
People in my lectures, they always ask, how much exercise should I do per week?
嗱，好多時啲人都會問我，究竟我每一個星期要做幾多運動？
Before I answer that, I ask another question.
我通常答佢之前，我會問另一個問題。
I tell them, you have to ask this question in a different way.
可能你用另一個方法去再問一次呢個問題。
How much exercise should we do per day?
究竟我哋每日要做幾耐運動呢？
So exercise should be a daily activity to prevent metabolic syndrome and to control weight.
所以其實運動係一個每日嘅功課。如果你想好好咁控制你嘅體重，同埋控制你唔會患上代謝症候群嘅話呢，你就每日都要做運動啦。
Now let's talk about an experiment that I did to prove that lifestyle can control metabolic syndrome.
嗱，以下落嚟呢，就係一個嘅實驗，我呢係話俾大家聽，究竟呢我哋點樣去控制呢一個代謝症候群？
We took a group of people from Hong Kong to Taiwan for 1 week in a resort.
咁我哋就帶一班嘅營友從香港去到台灣嗰度咧，係住1個星期。
So when they were there, they have a chance to practice exercise and a vegetarian type of diet.
嗱，而喺台灣嗰度咧，佢哋可以就係有機會去做運動啦，同埋係有一啲健康嘅飲食方式。
At least they practice 2 hours of exercise every day.
佢哋每日幾乎係做差唔多2個小時嘅運動。
And this exercise was almost natural. We didn't push much to go to the gym. Was doing outside.
嗱，我哋係做一啲好自然嘅運動㗎喎，係戶外嘅，就唔係咧去一啲健身室嗰度做。
It was like walking and swimming or playing games and playing sports that they even didn't realize that they were doing exercise.
我哋係鼓勵咧，譬如步行運動啦，有時候咧係游水啊，甚至係咧從一啲嘅活動裡面遊戲啊嗰啲，佢哋連做咗運動都唔知自己做咗運動㗎喎。
And then they have the opportunity to have daily health lectures.
咁啊，每日都有一啲唔同嘅專題講座。
And an opportunity to do some tourism and shopping.
更加開心嘅咧，就係可以去周圍遊覽一下，去買嘢啦。
So after 1 week, what are the results that we got?
1個星期之後，究竟嗰個驗血嘅報告有冇咩改變呢？
So you see that in the red part of this graphic, you have the blood cholesterol before they enter in the program.
嗱，呢一個紅色呢一條線呢，就係佢哋參加呢個活動之前嗰個膽固醇值啦。
And you see in the green part that all of them drop the blood cholesterol after 1 week.
所以綠色條線呢，就反映到呢，經過1個星期嘅治療之後呢，佢哋所有嘅人膽固醇都降低咗。
This graphic for me was very important.
嗱，呢一個研究咧對我嚟講係非常重要嘅。
Because before that, I always have the idea that to drop cholesterol, at least we need 1 or 2 months.
嗱，以前咧我都有個觀念就係，如果要降膽固醇咧，最低限度都要1-2個月啦。
But if you do the right treatment with diet and exercise, you can drop it in just 1 week.
但係原來淨係運動同埋一個健康嘅飲食方式，竟然喺1個星期裏邊都有效降膽固醇。
So another test that dropped was the triglycerides.
另外一個就係三酸甘油脂。
So you see in this graphic that most of them, they dropped the triglycerides in 1 week.
嗱，所以你可以睇到大部分嘅人咧都係降咗嘅。
You see the last graphic is a person that has or had the level of 300 milligrams per deciliter of triglycerides.
而其中一個咧係竟然超過300添。
And when she left the program, she was with a normal value of less than 150.
但係當佢完成呢個課程之後咧，佢竟然個三酸甘油脂咧，但係降低到咧係差唔多150嘅水平。
In the other graphic, you have the values for LDL cholesterol, the bad cholesterol.
嗱，另外一個就係一個低密度脂蛋白，亦都係我哋稱為呢一個唔好嘅膽固醇。
So most of the participants have a normal level or a lower level after they finish the program.
咁大部分嘅人佢哋參加完之後咧，佢哋嗰個膽固醇值咧都係正常翻。
So, as a conclusion, what is the treatment for metabolic syndrome?
咁總括嚟講，究竟治療代謝後群症有啲咩方法呢？
You have to take care of your weight.
你需要好好咁控制你嘅體重啦。
You have to use a low cholesterol, a low fat, a low animal fat diet.
我哋需要係食低脂、低動物脂肪、低膽固醇嘅飲食，
And a diet low in calories.
或者係低熱量嘅飲食，
Eat more fruits and vegetables and fibery foods.
多啲食蔬菜、水果同埋高纖維嘅食物。
And practice at least 30 minutes of exercise every day.
每日最少要有30分鐘嘅運動。
Dr. Santos, I know that I need to change my behavior. I have tried and tried.
山道士醫生，我知道我要改變我生活行為，我已經盡力去嘗試㗎啦。
But I don't know what happened. It's so hard. I cannot stop eating sugar. I cannot stop my pork chops and my white rice.
你知道嘛？我真係唔可以，我做唔到啊！你叫我唔食豬扒，你叫我唔食啲肥膩或者甜嘅嘢，我真係做唔到。
Dr. Santos, sorry, but I don't know. I can't change, Dr. Santos.
我真係唔知點解我改唔到咧。
I know, my friend, that it's very hard to change your behavior.
朋友，我知道改變係唔容易嘅，
And that's why we are here to help you, to motivate you to change.
所以我哋就嚟幫你，希望咧你能夠改變。
But sometimes even we cannot offer a power that you need to change.
但係有時候我哋都唔能夠俾到你有能力去改變喎。
And this power you find in the Bible.
但係呢個能力你可能從聖經裏面揾到。
I will just read a Bible verse here for you.
我想同你分享一個聖經嘅章節，
Philippians 4:13.
腓立比書4章13節。
And it says, I can do all things through Christ who strengthens me.
呢度咁講，佢話我靠着那加給我力量的，凡事都能做。
I believe if you go to God and ask Him, He will help you to change your behavior and to control your metabolic syndrome.
我好相信咧，只要你去到神嘅面前，佢一定會幫你去控制你嘅疾病同埋呢一個代謝症候群。
So most people that have metabolic syndrome, they have a problem to change their behaviors.
有好多患上代謝症候群嘅人咧，佢哋都覺得改變生活模式係好困難。
So we have for them one Bible verse.
咁我哋希望將一個聖經嘅章節係送俾佢。
Philippians 4:13, I can do all things through Christ who strengthens me.
腓立比書4章13節，佢呢度講到，靠着那加給我力量的，凡事都能做。
Metabolic syndrome, again, is a complicated name, is a complicated disease.
再講一次，代謝症候群係一個好複雜嘅名，同埋咧係一個好複雜嘅症群。
But if you take care of your lifestyle, you can avoid all of the consequences of the disease.
但係只要你好好咁照顧自己嘅身體，實行呢一個健康嘅生活模式嘅話咧，你就唔需要怕啦。
If you have metabolic syndrome, you have a higher risk of cancer and heart disease and stroke.
因為如果你有患上代謝症候群嘅話咧，你就患上癌症啦、心臟病啦、中風嘅機會都相對增加。
But now you know how to control it.
但係依家你已經知道點樣去控制佢啦，
Please take care of your lifestyle.
所以好好咁樣過一個健康嘅生活模式啦。
生命竟是如此短暂，随时消失，像雾一样。世事变幻，叫人难预料，谁能阻挡？ 会凋谢，草会枯干，诗人生命也是这样，再不把握永恒的方向，最会遗忘。你我都是地球一站的一名过客，为何迷恋世上的享乐？人生没有太多明日让你做抉择，若你错过救助，值得不值得？生命竟是如此短暂，随时消失像雾一样，世事变幻叫人难预料，谁能阻挡？花会凋谢，草会枯干，诗人生命也是这样，再不把握永恒的方向，最会遗忘。你我都是地球一站的一名过客，为何迷恋世上的享乐？人生没有太多明日让你做抉择，若你错过救助，值得不值得？都是地球一站的一名过客，为何迷恋世上的享乐？人生没有太多明日让你做抉择，若你错过救助，值得不值得？值得不值得？
你的时间真的是庸庸在何世上？其实我很盼望你的光阴来与我分享，来分享。
很多时候没有空闲，人都是很忙，可是每次来到电视面前都有时间看，不停看。可不可以现在开始把生命的方向用在有意义的事上？一起祷告，一起流泪，一起承担，一起爱，就算盼望我们将心门打开，不再徘徊，下定决心靠主的力量，现在主在身旁，张开臂膀，早已在等待你回来。你的时间怎样使用，用在何事上？只是我很盼望你的光阴来与我分享，来分享。很多时候没有空闲，人都是很忙，可是每次来到电视面前都有时间看，不停看。可不可以现在开始把生命的方向用在有意义的事上？一起祷告，流泪，一起承担，一起爱，初尝盼望我们将心门打开，不再徘徊，下定决心靠主的力量，现在住在身旁，张开臂膀，早已在等待你回来。可不可以现在开始把生命的方向用在有意义的事上？ 神的你亲爱，时常盼望我们将心门打开，不再徘徊，下定决心靠主的力量，谁能住在身旁，张开臂膀，早已在等待你回来。